Hello, I'm Dr. John Perlin, Chief Medical Officer and President of Clinical Operations for HCA Healthcare. Welcome to what is the 5th episode of A Physician's Lens. This is a periodic program in which we like to introduce to members of the HCA physician and provider community senior leaders and other guests who can really provide insight on the shape of healthcare today and really describe some of the things that are determining our practice environment. Along those lines, we're particularly privileged to have the Chief Medical Officer of HCA Healthcare's Physician Services Group, Dr. Christopher Ott. Chris, it's just great to have you here today, and welcome. And
Thanks, John.
It'd be great if you'd tell our colleagues a little bit about yourself.
Yeah, absolutely. So I'm Chris Ott. I'm the Chief Medical Officer for HCA's Physician Services Group. This week is my 5th anniversary with HCA. It's been a great 5 years. I came from Colorado, and I was with Centura Health before this, but going way back to start of my medical career. I'm an emergency medicine physician by training. I trained out at Denver Health and University of Colorado. I was in private practice for almost 12 years, and I moved into being a medical director of an emergency department, a hospital CMO, a division CMO at a different health system, and then I joined HCA in 2015 as the Chief Medical Officer of Physician Services.
Well, clearly your clinical background, your on-the-ground experience has just been invaluable in your leadership roles here. And we've certainly seen that in your leadership as part of our overall COVID initiative. Before we dive into COVID and some of the things that I know you've been working with, like telehealth, let's discuss PSG, or as we call it, or Physician Services Group. It actually has multiple dimensions, and I bet most people don't know about all the different dimensions and how they sort of tie together to create a practice environment.
The main legs of PSG, the first one is called PHY. It's Physician Services Group, PHY, which is our physician practices. And we're currently at about 1,300 different locations, and we have about 7,500 employed physicians and advanced practice providers. There's about 5,000 physicians in that group and about 2,500 APPs. That is the origin of Physician Services Group over the last 30 plus years, I'd say. The other legs of Physician Services Group are GME, so Graduate Medical Education. When I started 5 years ago, we had about 2,500 residents across the enterprise, and now we're at 4,020, I think is our number for this year, on our way to well over 6,000 residents. So we're the largest provider of graduate medical education in the country. And then we're also the home of urgent care at HCA, and so for those of you in markets that have Care Now urgent cares, those are run out of Physician Services Group. We also do the physician recruitment for the company, and recently we started working in the lab space in conjunction with Clinical Services Group because lab is such an important component across the enterprise.
And lab is a particularly important component at this very moment.
Absolutely.
With the advent of COVID, we're certainly taxing our lab resources to be able to support the patient care. Let's talk a little bit about the practice model and the impact of COVID. COVID obviously changed things for many people, whether you're an employed physician with HCA Healthcare or whether an individual is in one of our affiliated practices. Things changed fast.
Let's talk globally about how it changed physician practice, and I think that for our aligned physicians and physicians in non-PHY employed practices as well as my practices, it was devastating in March and April. I think physicians always felt, regardless of the social situation, regardless of the health situation of the country, the economic situation of the country, there would always be business. There would always be patients coming to seek care. And this March, April, May, I think, sent a shock through the physician community in that we saw volumes drop in some places to near zero, especially with the stopping of elective surgeries. And so surgeons, proceduralists, anesthesiologists, all of those specialists had a very difficult spring. And we are now climbing out of that difficult spring. I think there will be long-standing structural changes that come from that jolt to the physician community.
That's a really great point. It struck my family personally. My wife was a pediatric emergency physician, and her words were almost the same as yours, is that I never figured as a physician I wouldn't work and I never figured I wouldn't be needed during a pandemic. But it changed things. There were some adaptations, and you and your team have made some remarkable developments in very short order. I'm particularly impressed by the increase, the really exponential increase in the use of telehealth as part of the practice environment.
Yeah, so telehealth has been around for quite a long time, and we always looked at telehealth out of the physician services group lens as a direct-to-consumer offering. And for the most part, we didn't do telehealth. Our patients came to our bricks and mortar. In 2017, 2018, 2019, we did at a max 1,700 annual visits. That's 1,700 visits all 12 months out of the year. As of this Monday, the last numbers I got, we did 683,000 this year. We're probably over 700,000 at this point in the number of telehealth visits we've done. And you know, it was in March when we saw that the volume wasn't going to come into the clinics, when we saw that people weren't going to come to bricks and mortar to seek their care, and we have 3+ million established patients. You have to figure out a way to manage those people's chronic illnesses. You have to figure out a way to manage their acute anxieties about the pandemic. You've got to get them their chronic medications. You've got to get them screened. There's all sorts of stuff that obviously goes on in a doctor's office every day, and that kind of ground to a halt when patients decided that they weren't going to come into the bricks and mortar location. And so we quickly set up our telehealth platform. We grew it, and I'm proud to say that we now are able to see our patients in a multimodal fashion and meet them where they're at.
That's really terrific. And I wasn't exaggerating when I said exponential. Sometimes people are hyperbolic and it's a doubling. But yeah, from 1,700 to 700,000 is 1.5 orders of magnitude.
That's right.
It's interesting. I always figured that my kids would use telehealth, but my 95-year-old father has gravitated to it. I don't think he sees it as a replacement for in-person care, but I do think he sees it as an adjunct, and I'm wondering how you see the use of telehealth sort of interdigitating with more traditional care delivery going forward.
So it's just another access point for us, for our patients to use. And as we talked previously, we obviously have bricks and mortar with our physician services clinics. We have urgent cares, we have freestanding EDs, we have hospitals, and telehealth is just an extension of that access to the care that HCA provides for our communities. As for patients, they have fully embraced this and quickly. So speaking of your dad, my dad, who's 78, did his annual wellness visit for Medicare by telehealth this year. Had you asked me this last January, I would have said no way. He would have been going into the clinic to have that done. What we're using telehealth for at Physician Services Group, though, is to meet our patients' needs. So in episodic care, allergies, UTIs, chronic medications. There have been historical diagnoses and physical complaints that patients have had where we have more or less asked them to come to bricks and mortar to have that treated. And I think now we are getting more comfortable with the idea that I can see you on telehealth, I can have you go to a lab, I can have you go to an imaging center, I can have you collect biometrics at home, and I can solve a lot of your problems without you coming into the bricks and mortar location, and that's where this is headed. The other thing I'll say is it's been surprising how many specialties have been involved. And so if you look over now our 6 months of billing on this, and you look over all of my data through the health record, I'm only about 40% primary care. I'm 20+% cardiology, I'm 5% OB, 5% neurology, 5% behavioral health. And so this is not just I'm solving a rash problem, a medication problem, the things that you see on the TV for telehealth. We are solving chronic care issues for patients this way.
Well, Chris, I think that's really an interesting set of use cases, and I think one of the things that's unique and special and frankly in just the right place for the Physician Services Group is something I've actually been predicting for a number of years. The convergence of the electronic health record with telehealth as really a more unified platform. It solves some of the issues that the ad hoc approaches have in terms of HIPAA compliance. And clearly, I think you all see this as part of the armamentarium of practice in the future.
That's right. This would not work for physician services group, and this would not work for most specialists and primary care that does longitudinal care if it was not tied into the data of the patient in a longitudinal record. The other telehealth platforms that are not integrated with health systems, not integrated with physician practices, I think, provided episodic care and they met patients' needs in a particular fashion. But they certainly were not as integrated as they are when they actually speak to your medical record, and then you have that data to make longitudinal decisions with.
Well, this is a hot topic in the health policy community. I have the privilege of sitting on MedPAC, the Medicare Payment Advisory Commission, and not surprisingly, two of the most important discussions last time were on COVID and its impact on healthcare, and specifically on telehealth, how it would be reimbursed in the future, et cetera. It's obviously not as resource intensive as in-person visits, particularly those with a lot of capital equipment, but obviously it needs to be compensated, and this has been a real-world demonstration of the utility complementing the more traditional modes of care. So you've described an extraordinarily vibrant, complex, multidimensional practice setting that is HCA Healthcare and the Physician Services Group. So if you're talking to a provider in the community that we'd like to have join us, what do you tell them about the benefits of the HCA Healthcare model?
Yep, so the benefits of the physician services model within HCA. So I'll say HCA Healthcare globally is a great place to practice, right? I mean, the hospitals, great places to practice. The surgery centers, great places to practice. The urgent care is great places to practice. So not every doctor needs to seek out an employment arrangement. But if they are seeking out an employment arrangement and they're seeking out a closer relationship both with Physician Services Group and then obviously with HCA Healthcare, there's a couple things that I think over the last 20 years of practice have become so complicated that the idea that moderate to smaller size practices can go on in perpetuity is just becoming more difficult for individual business-minded physicians. The IT structures are complicated. The data structures are complicated. The payer models, both government and commercial payer models, are very complicated. And so when we hire physicians or when they join existing structures or we acquire large established practices, what we bring with us is our expertise from across the country in how we respond and how we succeed in those models, and then we set physicians free to see patients. My advice to my operators, right, so I have practice managers and market managers and all the IT folks and the billing people, everybody that makes this all work, is our fundamental goal is to get a patient in front of a physician or in front of an advanced practice provider, and that should be done in as efficient a manner as possible, and that's what we strive to do.
It's all about the care. And,
absolutely.
Making the caring is all about the people like Dr. Christopher Ott, our Chief Medical Officer, Physician Services Group, and people like the tremendous community of fellow practitioners, physicians, advanced practice personnel, and other clinicians across the HCA Healthcare family. And as this COVID epidemic continues on, as the challenge of kids going back to school and the complexity of work-life balance presents itself, Chris and I really join in thanking each and every one of you for everything that you're doing every day to make sure that we live the mission that, above all else, we are committed to the care and improvement of human life. Thank you again.